Sunburn. Sunburn is an inflammation of the skin caused by overexposure to UV radiation from the sun. UV radiation damages the skin and the eyes. Immediate symptoms of sunburn are hot, red, and tender skin, pain when the skin is touched or rubbed, and dehydration. Several days after sun exposure, the skin may swell, blister, peel, and itch. Most sunburns are mild and can be treated at home with natural home remedies that provide pain relief, treat and soothe blisters, peeling, and skin inflammation. Examples of home remedies for sunburn pain and relief include applying damp clothes or compressing to reduce the pain, soaking in slightly warm water with no soap, gently patting the skin dry, applying soothing creams or lotions, using OTC pain relievers for pain and inflammation, for example, acetaminophen, and non-steroidal anti-inflammatory drugs like ibuprofen. Sunburn may cause permanent skin damage and skin cancer. UVB as well as UVA rays may cause damage to the skin. UV rays may bounce off water, sand, snow, and other surfaces, causing sunburn. People with certain pigment disorders like albinism, lupus, porphyrias, vitiligo, and xeroderma pigmentosum, and those with fair skin are at most risk of sunburn. Some medications may increase sensitivity to sunburn. Sun poisoning is caused by severe sunburn. Symptoms of sun poisoning include fever, nausea, chills, dizziness, rapid pulse, rapid breathing, dehydration, and shock. Heat stroke is a severe form of high body temperature that is life threatening. UV rays are most intense at noon and the hours immediately before or immediately after, that is between 10 a.m. and 4 p.m. The best way to prevent sunburn is to avoid long exposure to sunlight. Sunscreen and sun protective clothing are important measures to limit sun damage. Apply sunscreen before going outdoors, apply it liberally, and reapply it frequently. Symptoms of sunburn. Some of the immediate symptoms of sunburn after exposure include the skin becomes red, tender, and hot. Touching or rubbing the skin causes pain. Because heat triggers fluid loss, a sunburn victim can also become dehydrated. For several days after the exposure, the skin may itch, swell, blister, and peel. Some sufferers develop welts or rashes. Skin peeling can occur several days later after sun rash develops and is a sign of healing and rebuilding of the skin. More subtle exposure to the sun may not have any obvious immediate symptoms such as the ones listed above. Most sunburns are mild, causing only skin redness, pain, and irritation, or possibly a rash due to involvement of the outer layer of the skin. This is first degree burn. This type of burn may be painful to touch. A more moderate sunburn, that is the second degree burn, may cause the skin to become swollen and very red with painful blisters. This type of sun rash may take longer to heal. People who have chronic exposure to sun can increase their chances of developing chronic skin damage from sun exposure. The symptoms of sunburn can be mild, moderate, or severe, depending mainly on the following: the skin type of the person affected, the time, duration, location, and altitude of exposure, medications of the person that he has been taking. Drugs may increase a person's susceptibility to a bad sunburn. Skin preparations or sunscreen the person has been using. In addition to the usual symptoms of sunburn, a severe sunburn or sun poisoning may cause fever, nausea, chills, dizziness, rapid pulse, rapid breathing, dehydration, shock with loss of consciousness, and severe blisters or soreness. A severe sunburn also may be associated with heat exhaustion or heat stroke, which is a medical emergency. Severe cases of sunburn require emergency medical treatment. A follow-up visit with a physician is not necessary unless the sunburn was severe. If you have had a significant sunburn, talk to your doctor so that he or she can do a skin body exam to look closely for symptoms of skin cancer or any other problems that can be caused by a severe sunburn.